Hello. Okay, this one is going to be a question about the anterior quads and hip flexors. This one is kind of tricky. The only reason it's tricky is because we all spend most of our days sitting. So when we are sitting, I'm just going to kind of use this as an example. So our quads, they're the whole front here, but they also attach all the way up to the front of the hip bone. So give me just a sec. So here's the front of our hip bones, that little bony part right here, and they come up and they attach here in the front. So what I want you to notice anatomically is how that would rotate and twist the pelvis whenever it's too tight here in the hip flexor. So a lot of time when this is too tight, you're rotating that pelvis forward and you end up with low back pain also. So it's one big crazy machine, but we end up hip flexors attach right here, and when they're too tight, they pull that pelvis forward, okay? That also has to do with sometimes a weak core. So let's talk a little bit about how we can stretch this out, especially with being seated all day long. It just stays shortened. So then when we go to stand up, you're really trying to tug and pull and you're having some of that discomfort. I got scoliosis, here we go. There we go. So it really causes some stress on the front pelvis and all the way down, and even you can have some anterior knee pain when the quad is too tight. So what we're gonna do is, what I want you to do every day, like if you're gonna be working all day long and you're gonna be in a seated position, I want you to be doing some dynamic stretching and flexing out, getting that quad and that hip flexor stretched. So I want you to pull that knee up and I want you to do a big lunge backwards. It's nothing, not anything to get your heart rate up, but I'm just wanting to get that hip flexor moved up, blood flowing a little bit, okay? You could do it on both sides this way. Then I want you coming in and out, just kind of some hip openers. And this is just as a way for injury prevention, okay? Just to help you feel a little bit better when you're sitting all day. Then, with our exercises and things that we're doing when we're shortening those quads and we're causing stress on those hip flexors, the best stretch that I have found that helps people so much is you're gonna do it bilaterally, okay? Doing it both sides is gonna help with any imbalances, but let's say my right side hurts, okay? Right in that hip flexor. So my right leg is gonna go down. I'm gonna tilt my camera down just a little bit here so you can see me a little better. So your right knee is going to go down, okay? I am in a neutral position. My right knee is down. You're going to lean your torso back. I don't want this. I don't want full twisting and tilting. I don't want you falling over. I want you to pull that belly button in, and I want you to just barely lean back. So I feel that all the way down the front of my quad and all the way up actually into my core. So let's also talk about stretching, okay? Stretching is not cookie cutter. It's meant to help you as a person. It's not Googleable. It shouldn't be Googleable. One movement does not work perfect for everyone, okay? So for instance, me right here, I feel a really good pull just barely leaning back like this. Sometimes you need to add some twisting to it. You can bring your arms all the way up, rotate in that opposite position, but you're gonna rotate away from the knee that's down, okay? So as you can see, I'm leaning to the left with my right leg down. I feel a stretch all the way up into my core, okay? If you're not feeling a stretch just doing this, add some twist to it. Figure out exactly what works best for your body to where you feel that. The idea is anatomically, you're pinning that down. So in any way that you move it, you will eventually start to feel a stretch. So doing that bilaterally, both sides, leaning all the way back and kind of leaning across. I feel a really good stretch there, and I imagine that most people, if we spend a lot of time sitting, you'll feel a good stretch there too. So just like that. The other thing that's awesome for quad tightness is foam rolling. Using a foam roller all along that quad. I don't have one in here right now, and maybe I'll grab one for another video, but you just are gonna throw a foam roller down on the floor and just roll back and forth on it in this nature and help to work out that hip flexor all the way up and all the way down the quad, down to your kneecap. That is all attached, okay? I hope that helps. Hip flexors are really tricky because we spend most time sitting, so taking breaks throughout the day will make that tightness when you go to work out and go to recover not feel so gross and hurt so bad. So try doing a little bit more dynamic stretching throughout the day, and then doing this static hold before, you can do it after, you know, right after that exercise. Hold it until you feel a really good stretch, okay? All right, I hope that helps.